everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. A quick note whether I'm audible and visible, everyone. Yes. Okay, great. So, welcome to this today's YouTube live session. And for all the students who have given the exam today, I hope the exam treated you well. Overall, I've got a good review of the exam in the sense that it was not very difficult. It was very much doable. And as compared to the last exam, it was more on the easier side. And if I have to compare the part A and part B, the part B was more easy, right? So I'm pretty sure that we are going to get some great passing percentage and good results this time. All the best to everyone who have given the exam today. And one thing is very sure that you've worked very hard for today. So you deserve that break. So now it's a time to take a chill pill, relax, right? To do whatever you want to. And a disclaimer here that here we are in this session to discuss the questions that appeared in the exam from radiology. These are purely recall based, so these might not be the actual, the actual questions, but overall to give you a review that what questions, what topics were asked in the exam from radiology. That helps you to understand the trend that is going on in the exam year on year, right? That's one disclaimer that I want to give. And second disclaimer is the more important disclaimer that I want to give is that now that you have given your best, leave the rest. Tell yourself that I have given my best and now I would leave the rest, and whatever results are going to be, hoping for the best, but at the same time, prepared for the worst, right? So remember that your victory is in having done your best. If you've done your best, you have won. At least for me, if you've given your best, you have already won. The result, whatever might be the result, remember that the result is not going to define you. Irrespective of the results that you get, you are unique and you will always be unique, right? So remember that if you've given your best, ask yourself honestly that did I give my best? And if your heart tells you that you could do the best that you could do, so that means you have already won. So your remaining days, सबसे पहले this cycle always goes on. एग्जाम के पहले एग्जाम का टेंशन कि पेपर कैसा होगा, इजी होगा, डिफिकल्ट होगा. एग्जाम खत्म होने के बाद रिजल्ट का टेंशन, पता नहीं अब रिजल्ट क्या आएगा. एंड आई थिंक दैट गिव्स ऑल द मोर एंजाइटी. बट अंडरस्टैंड दैट however it has been, you cannot change anything just worrying about it or just thinking about it. So these recall sessions are not to make you feel like good or feel bad, but the recall sessions are more so for learning, because even if you have given your FMG, you are going to give NEET PG, right, in the coming time. If you are a next batch student, you're going to give the exam soon. So these recall sessions are basically the learning sessions and not to make you feel good or feel bad. Nilbhai, I would actually like to disagree there. I will not agree there. See, you asked like multiple students about a particular resource. Like, did you see the questions coming from there? How was the strike rate? You would always get a mixed review, though the paper is the same. Why? Because how well you have understood whatever was delivered, how well you can apply whatever we as educators delivered. That's another step. One step is listening to whatever we are teaching. Second, more important step that I understand is understanding how to apply whatever was delivered to you. And a question same to same जो line हमने पढ़ाया वही line आएगा, ऐसा नहीं होता है. But the purpose of all the sessions that we have is basically to give you that raw material on which you can build up and solve the questions. That's why we always tell you that question bank practice karo, question bank practice karo. That's where you would realize how to basically apply whatever you are learning. Yes, so that was about the beginning. And one more thing, remember that if you feel that मैंने बहुत मेहनत की but the paper did not go as I had expected, Remember that someday everything will make perfect sense. So for the time being, the only thing that you have to do is just laugh at the confusion and smile through the tears if you're even if you're feeling like crying, because there's a mixed review again. I see some students are like paper easy tha and some students are like nahi bahut hi difficult tha. So if you are on that end who's feeling that ki nahi bahut difficult tha, just smile through the tears, be strong and keep reminding yourself that everything happens for a reason, right? If you're feeling that paper was difficult, utna acha nahi hua, there's a reason behind that. And majority of the times, I've seen it myself, like, we are in touch with students. So always in communication with students. The students who feel that, nahi, nahi, bahut ganda paper tha, acha nahi gaya, they actually clear the exam, right? So do not go into any like depression state, just thinking कि मेरा paper अच्छा नहीं गया, उतना भी गंदा नहीं गया होगा जितना गंदा you are thinking, right? It might not be as bad as you are thinking. So the recall sessions will basically help you understand that, how well you have performed. Satyam, thank you so much for that. See, that's what I'm saying. So there are students who will be like, LRR was very, very helpful. And like I said, there's always going to be the contradiction there. Okay? Yes. Chalo, let's start. हाँ भाई कर रहे हैं start. Radiology per se, you did not have like core radiology, the image based questions per se, a lot of them. There are 4 to 5 questions that we have got to know from the students. Is the audio still low? Let me try increasing that. Is it any better now, Slayer? Yeah, am I audible now? Okay. So identify the lesions given in the image. I think there was clinical history also given there. And the clinical history mentioned that it was a smoker, right? The question mentioned that it was a smoker with weight loss. Ka history was there, right? Smoker with weight loss. So remember that smoker with weight loss and this chest x-ray basically tells you that this is cannonball metastasis. When you see bilateral lung lesions which are almost on the same size in a patient where weight loss is there, smoking history, so lung cancer is what you are suspecting. So remember the answer here is cannonball metastasis. We are seeing it in the radiology questions in the recent years. The clinical history also helps you answer the question, right? So remember that. Please try to increase your resolution. Whoever is finding the screen is blurred. The screen per se is not blurred. Advanced settings में जाके video resolution at least 360 करो. You will see it better. Okay? Just give me a minute. Yes, so I was trying to do it myself कि जो मैंने बोला वो सही है कि नहीं, and it actually works. चलो, let's go. So this is अगर मैं 2x स्पीड पे गई ना अक्षु तो 5 मिनट में खत्म हो जाएगा. ठीक है? क्वेश्चंस इतने हैं नहीं यहाँ पे रेडियोलॉजी में. So this is bilateral cannonball metastasis is what you should remember here. If it's a patient of abscess, you would have history of high-grade fever as well. Septic emboli, sepsis, again there's going to be history of fever as well. So remember the clinical history is important here. Okay, the clinical history is important here. Right. Going to next one, I think was this image there? I don't think this image of fibroadenoma ultrasound image was there. Was it a histopath image rather of fibroadenoma which was asked? It was a histopath image of fibroadenoma which was asked rather than the radiology image. But yeah, image है हमने डाला है तो आप सीख लो कि क्या है ये. So remember that in fibroadenoma, basically it is a mouse in the breast, like it is very, very mobile. And on ultrasound, this is what you would see. Next time, इस बार पूछा histopath, next time ultrasound पूछेंगे. So we are not just doing the recall, we are PYQs, we are doing the FYQs also, the future year question. So remember that if it is an ultrasound image, it is a hypoechoic lesion. It is a hypoechoic lesion which can have lobulated margins and it is wider than taller. Okay, which is wider than taller. The wider than taller tells you that the lesion is growing in the same plane and it is more benign. Okay, so yes, it is fibroadenoma. The ultrasound image was not there. All of us are agreeing on that. Okay. Popcorn calcification is what you would see on mammography. Popcorn calcification is what you would see on mammography. The explanation mentioned rubbery consistency, mobile. Okay. Right. Got it, Palash. Thank you so much. Keep giving in those reviews so that we know what exactly the question was. Next is identify the hemorrhage. This is like a patent question in all the exams, a type of hemorrhage. This was, SDH was asked in this year's NEET PG exam as well, right? So this is basically the subdural hemorrhage, which you are seeing here, because remember the trick is sickle shape, S for S is subdural hemorrhage. Okay, sickle shape, S for S, it is subdural hemorrhage, which is because of the rupture of the cortical bridging veins, right? The rupture of the cortical bridging veins, and it crosses the sutures, right? These are the points that you need to know for subdural hemorrhage. ठीक है कुमार, इसको मैं अगर फ्लिप कर दूंगी तो ये राइट साइड का हो जाएगा. ठीक है, so I've shown you the flipped image, जो राइट का लेफ्ट हो गया है. तो राइट हो या लेफ्ट हो, ऑल यू नीड टू नो इज कि सबड्यूरल हेमरेज इज सिकल शेप, दैट इज क्रीसेंट शेप, और इट इज दैट इज कॉन्केवो कॉन्वेक्स शेप. ओके, कॉन्केवो कॉन्वेक्स शेप. ठीक है, half sickle black and half white was there, which basically tells you if you have the sickle which is half white and which is a half black, so basically it is your acute on chronic SDH. The dark part tells you it was chronic, and on the white part tells you now there's an acute component as well. SDH was there, right? Midline shift can be seen, Shravan, in any cause which is occupying a lot of space and pushing the structures to the opposite side, right? Like in this case as well, particularly if I talk about this CT, this is the midline that you have, but look at the ventricle wala, ye midline jo brain ka hai, it is not coinciding with this midline. So there is a midline shift to the opposite side. Okay? Right. Yeah. Going on to the next one. Collapse lung mein kya tha? Was this question there? I think there was a question of the CD chest heart ka chamber pucha tha. Was this question also there? Showing you, asking you whether where is you have the pancreas, liver and spleen here. Was this question there? Okay, I'll come to that next, talking about if it's a white hemithorax. It was there? ठीक है. There'll always be some students who will say कि ये नहीं था. नहीं, ये question था क्या pancreas वाला? So let me quickly discuss this. ये था या नहीं था? So remember, this is a CT scan with the white bone. This is the aorta. Now logically thinking, if you are asked that, where is the stomach? You know, stomach basically will contain fluid as well. It's a GIT, the bowel, the stomach containing fluid. Fluid we know is gray on CT. So this part basically with the rugae also you can see the stomach has a rugae. So this is the stomach. This is the liver here on the right side, and behind the stomach here on the left side you have the spleen. So liver, stomach and spleen all was asked. Okay? Image was different, but the question was the same, right? But the learning point here is the most important point you should know here in radiology. This is the right side and this is the left side. Your right is the patient's left and your left is the patient's right. So this is why on the right side, basically you are having the liver here. You can see that liver goes till the anterior abdominal wall, right? Liver is anterior. Spleen यहाँ पे पीछे की तरफ. Okay? All right. Next one that we have is, I think even this radiological question was not there, but you had a clinical scenario of a patient having distended neck veins, muffled heart sounds, hypertension also mentioned. Then that is going to be your cardiac tamponade. That is going to be the cardiac tamponade. Pancreas tha, agar pancreas tha, I'll go back to this question here. Pancreas will come at a lower section which is not seen in this particular image. So pancreas will be seen here. It is more deep seated organ. So vertebra ke aage, stomach ke piche is where you would see the pancreas. You would see the pancreas going towards the splenic hilum. वो थोड़ा और नीचे आएगा. All right. So look at this one. The question that you had here was a clinical question, that what would you see in the JVP? Again, this is your most favorite topic. Constrictive pericarditis and tamponade ka JVP. Remember that, the trick to remember so that you never forget it, whether you revise it or you don't revise it one day before the exam, you should remember it. And that is in constrictive pericarditis CP, it is combined present. That means X also present and Y also present. Now, which is more steep here? So remember it as it is pay tax. Okay, for the steeper one, what do you have here? In pericarditis, PY. In pericarditis, the Y is steep. In tamponade, the X is steep. That means the X is present. So what is absent? The Y is absent. Okay, the Y is absent. So remember that in tamponade, you have the absent Y decent. You have absent Y decent. Okay. Right. The other question that we were talking about, the CT chest, basically asking the heart chamber. This is a repeat question. So if you see in radiology, cannonball has been asked previously, SDH, EDH are always asked. The CT heart chamber is also asked. Even the CT abdomen normal images have been asked. So there are like no questions which are like out of the box and very, very eccentric. So if you have done your PYQs, not just the questions, the topics very well, you'll be able to solve the questions. I'll come to the question of lung collapse. So here in the CT chest, for everybody who wants to understand that how do I identify the chambers of the heart on the CT. This is something that we have discussed. Okay? So remember that this is the heart that you are seeing here. So if this is the vertebra that we have, in front of the vertebra on the left side, we have the aorta. And in front of that, you have the heart like this. Okay, this is how you have the heart. अच्छा ठीक है, heart वाला cadaveric image था. Cadaveric image हो या CT image हो, the anatomy will remain the same. है ना? So you need to understand the concept here. Even if you apply it to the cadaveric image, it will be the same. ठीक है? So direction mention था तो और easy हो गया. ऑपोजिट इमेज आया था क्योंकि कैडावरिक सेक्शंस आपको जनरली उल्टे ऐसे दिखाए जाएंगे, सीटी रेडियोलॉजी इमेजेस उल्टे रहते हैं. द कॉन्सेप्ट इज स्टिल द सेम. व्हाट इज द कॉन्सेप्ट इज, फॉर इन द हार्ट, द चेंबर ऑफ द हार्ट विच इज एंटीरियर मोस्ट. एंटीरियर इज द स्टर्नम बोन. स्टर्नम के पीछे जो हार्ट का चेंबर यू सी, द एंटीरियर मोस्ट चेंबर. So remember that it is the anterior most chamber is the right ventricle. Okay, the anterior most chamber is the right ventricle. While on the other side hand, remember the trick is to what is the posterior most chamber if right ventricle is anterior most? Do the opposite of right ventricle. It becomes the left atrium, which is the posterior most. Okay, which is the posterior most. So, तो राइट साइड लेफ्ट साइड क्वेश्चन में मेंशन्ड है, सो दैट मेक्स इट मोर इजी कि ये राइट है कि लेफ्ट है. वर्टिब्रा देखो, वर्टिब्रा के आगे आएगा लेफ्ट एट्रियम और स्टर्नम के पीछे आएगा राइट वेंट्रिकल. So just in front of the vertebra, it is going to be the left atrium and this is going to be the right ventricle. So if this is the midline of the heart, if this is the right ventricle, this is going to be your right atrium and this is going to be the left ventricle. Atrium के बाजू में atrium, ventricle के बाजू में ventricle. ठीक है? Is this clear with everyone? Mohit, see the cadaveric images look very confusing, but if you stick to your basic concepts, decoding the image like this, कि अच्छा ये vertebra है तो उसके आगे जो रहेगा सबसे आगे वो left atrium होगा. ठीक है? That is how you basically decide. All right, so remember anterior most is your right ventricle and posterior most is left atrium. So if I have to decode the CT image, previous FMG exam, the CT image was asked, right? This time the cadaveric image has been asked. Male partner treatment is needed in trichomoniasis, right? So if you have learned the tricks with me, the mnemonics also, remember trichomonas, TR, all the TR for trichomonas. What are all the TRs for trichomonas? Can someone tell me? Trichomonas, the TR is the strawberry cervix. Okay, you have the strawberry cervix. Next, strawberry cervix. दूसरा क्या है TR? The TR is, it is transmitted sexually and that is why there is treatment of the partner also needed. The drug of choice is metronidazole, again the TR. And what is the color of the discharge? What is the color of the discharge? Remember, it is tree color. that is green color. Okay, tree color, that is green color. Remember, all the TRs is basically is what you have for TR, trichomonas. There is one more TR. Remember that in TR, there is trophozoite only. Trichomonas has trophozoite only. Okay, trichomonas has trophozoite only. So, trophozoite only, no cystic stage, strawberry cervix, transmitted sexually, needs the treatment of partner, metronidazole, and it is tree color, that is green color. Okay, that is green color. Right, remember trichomonas needs the partner ka treatment. All right. Going to, so this image, the CT image that we were talking about, these are the 4 chambers. Sternum ke piche rahega right ventricle and vertebra ke aage rahega left atrium. Okay, so this is right atrium and this is going to be left ventricle. Okay, so this was the question, and one more question that you are mentioning here that we have is, suppose there was this question of the white out hemithorax. Okay, I'm quickly discussing the concept of white out hemithorax. So remember that white out hemithorax, the causes are, what looks white on X-ray? Air does not look white. So pneumothorax white nahi hoga. Pleural effusion is white. Fluid appears white on X-ray. Consolidation, solid, the density increasing. Whenever the density increases, like the bone, it appears white. Third, the collapse is also the cause of whiteout hemithorax. Because I don't know what image was asked, that's why I'm telling you the concept here. How will you differentiate kiska cause kya tha? Collapse, why is the collapse white? Because in the collapse, the air is not there. No air means no black area, means it is going to be white. Okay, it means it is going to be white. Yes. So how will you differentiate the 3 causes is based on the tracheal shift, that is the mediastinal shift. Pleural effusion, the water needs space, so it pushes the trachea to the opposite side. Where is the shift in consolidation? Where is the shift in consolidation? Remember, in consolidation, the volume remains the same. There is no shift. It is just that the air is replaced by something more solid. That is solidification. So the volume is the same. There is no shift. In collapse, collapse is the volume loss. Whenever there's collapse, there's fibrosis. They pull the structures towards themselves. That means it is same side. Okay, that is same side. So now you have to tell me whether the image had opposite shift, no shift, or same side shift. So based on that, you will answer. Yeah, yes, we have definitely discussed that. So remember, based on that, you have to discuss something which can look similar to collapse is also pneumonectomy. Okay, pneumonectomy, lung nikala hai, so it's like a collapse, the volume loss, there will be same side shift. Okay, there's going to be same side shift. And one more question that I got to know is, was there a question, if pneumothorax was option, Asra, that's the first option that you rule out because pneumothorax is black. If trachea was shifted to opposite side, I don't know what your name is, explotas. So that is where you are going to have opposite side pleural effusion. मोहित मैं वही बता रही हूँ कि फुल साइड वाइट मतलब हमेशा कोलैप्स होगा, ऐसे नहीं है. इट कुड बी कोलैप्स, इट कुड बी प्लूरल इफ्यूजन, इट कुड बी कंसोलिडेशन ऑल्सो. ऑपोजिट साइड शिफ्ट था तो वो प्लूरल इफ्यूजन होगा. ओके, नेक्स्ट वन, वाज देयर वन क्वेश्चन ऑन पेट कि व्हाट डू वी यूज इन पेट, व्हाट सब्सटेंस इज यूज्ड इन पेट? What substance do we use in PET? Right, correct. Remember, most common we hear is the FDG PET. So remember, it was fluorodeoxyglucose. Fluorodeoxyglucose is what we use in PET. So fluoro and deoxyglucose. So one is the fluoro and one is the deoxyglucose. Out of that, F is the F18, which is the radioisotope which is used in PET. Again, a previously asked Fmge exam question. So this is sort of repeat. पहले पूछा था कि रेडियो आइसोटोप कौन सा यूज करते हैं, इस बार पूछा है कि सब्सटेंस कौन सा था. So remember, it is radioisotope used in PET is F18. Why do I use F18 and not technetium? Because F18 emits positron. When I say PET is a positron emission tomography, while technetium 99 emits gamma. Okay. And deoxyglucose is the ligand. Deoxyglucose is the ligand which is bound to F18. So this deoxyglucose basically carries F18 into the cells. Glucose, deoxyglucose goes into the cells. So this is the ligand that is the carrier of F18. Why do we use deoxyglucose as the most common ligand? Because we do PET scan most commonly for cancer. And cancer cells through Warburg effect increase glucose uptake. So we want to see the increased glucose uptake in cancer cells. So we use this deoxyglucose. Okay, deoxyglucose. Right. Cobalt 60 का question एक option था कि क्या था? Or was it a different question or the same question? Yes. Someone was mentioning a question. There was this question of congenital diaphragmatic hernia, but it was a clinical question. The image was not there, but it mentioned that on X-ray chest, you are seeing the multiple air fluid levels in one hemithorax, let's say on the left side. So when we say that you in the thorax, you have multiple air fluid levels in a newborn, that is basically the bowel loops. The bowel loops containing the fluid and the air. Okay. I'm not very sure of complication of ERCP, but as far as what my memory says, pancreatitis is one complication, but I am not committing on that answer. Right, I'm just telling you on my memory base, but exact answer मुझे नहीं पता. ठीक है, कोबाल का different question क्या था आपको बताना होगा, पता नहीं. So I think these were the questions that we had basically in radiology, right? So you can see all the radiology questions that I see are like the ones which have been asked previously and the much expected questions. So if you ask me personally, like many of you are asking me, what do you think was the difficulty level of the paper? According to me, whatever I'm seeing so far, whatever I'm hearing so far, the paper was on the easier side. The one-liners were there, right? So remember that to crack your exams, you need to have your concepts, right? So I always say there are 4 pillars to crack this exam. It is concepts, mnemonics. Where there is no concept, you need to mug up. So learn it with mnemonics so that you don't forget. Then applying this to the MCQ. MCQ solving skills is the most important then. Third step. And the fourth, you have to keep revising whenever you are preparing, right? It's not just like read one time, multiple resources. Stick to one. Like you get everything on the PrepLadder app. You have the best rapid revision. You have the updated Q bank. Now you're getting LRR also. So stick to one source because everywhere the content is the same. It's the revision and the MCQ practice from the Q bank that really matters, right? So that was from my side for today for the radiology recall. And again, please remember that if you have given your best, you have already won. The results are secondary. The results are not going to define you. And keep priming yourself, keep telling yourself, result chahe kaisa bhi aaye, I'll be ready to accept it, right? So just tell yourself, I did the best that I could. Now I give my best and then I leave the rest. So time to enjoy, time to take a break, time to go out with your friends, time to chillax, watch some series, watch some movie, and spend some time with your family, the friends, and the loved ones. And the most important, sabse pehle, give a pat on your back, like you have come so far with all the hard work and dedication. Definitely that's going to pay up with some good results. So all the best for your results, guys, and I'll be waiting to hear from you again with some good results once the results are declared, and we'll meet there for some on one-to-one interview for sure. Thank you and all the very best. Goodbye, take care, and keep studying, keep revising, and keep winning. Thank you.